Is there any kind of definition between, I live in a senior housing unit, but from there to a nursing home, are there recognized definitions in between?
No, that's part of our
nursing
problem.
homes are defined.
That's clearly defined, but everything else is not. And that's part of our problem, and then that they aren't even regulated, as such. So, all these lines are blurring. So when you, as a resident, are looking at a facility, it makes it tough for you to really figure out, is this the right one for me or not?
And we have a rental shortage throughout the state, especially in urban areas. So I think of the assisted living, to the extent that there is pent-up demand for this, I equate that in a similar way that we have demand for all sorts of affordable housing for all populations.
Now, there are mixed service facilities, are there not? I was when I went through rehab after my knee, I was in a facility that I think had a nursing home wing to it. It's in Hopkins.
Yeah.
Is that a common kind of thing?
I don't know how common that would be. Types of facilities. So it is common to have a facility, whether it's a campus or one building, have a variety of types of services offered.
The League of Women Voters is a nonpartisan political organization, which means we are interested politically, but we never support candidates or political parties. Rather, we study and lobby on issues and work to educate voters. This summer and fall, members were working diligently to register voters and help with any questions that people had about voting. These first Tuesday discussions were preempted by the November election this year, and as in most years, I am proud to say that Minnesota had the highest turnout in the nation. Yay. The fortunate and unfortunate fact about a democracy is that it's ever changing, and we always need to keep an eye on process and transparency. Thus, our work with the League of Women Voters is never finished, and we must always be vigilant. The Civic Buzz is one way we continue our work throughout the year, bringing issues to you and making you more knowledgeable so that you can know the how, the why, and the when to take action. Thank you for understanding the need to be informed and taking the time to be here and to learn about tonight's issue. And thanks to the Whittier Alliance for sponsoring the Civic Buzz by advertising these programs in their network. And thanks to Bill for being here and videotaping this tonight. Our format changes a bit tonight because we have 2 speakers instead of 1. With that in mind, the speakers will each speak about 15 minutes and finish up by 6:45 or so to ensure time for your questions. We find that the questions always bring out more information, but they're directed to your interest. And then we will officially close at 7:30. However, if you wish, we encourage you to stay and continue discussion. Our topic tonight has been in the news. It was just a year ago in November of 2017 when the Star Tribune began a 5-part series called Left to Suffer about abuse in senior care centers. Tonight we want to follow up on any action that has taken place since and to find out what we can do to make changes as the legislature meets in the new year. Polly Keppel has been instrumental in bringing this topic to our attention, and she's here tonight to introduce the speakers. Polly?
Thank you, Jelaine. Since we're sort of informal, Kris and Sean, do you just want to stay at the table? And then when it's time for you to speak, you can come to the podium, but that way you can sip on your beer and enjoy, rather than having to sit in the 2 chairs and face everybody else sipping on their beers. As Jelaine mentioned, about a year ago, the Star Tribune published a startling 5-part series on the abuse some Minnesota elders were facing in long-term care. These articles also highlighted the inadequate, under-resourced, and antiquated procedures the Minnesota Department of Health was using to address this crisis. Tonight we welcome 2 speakers who, from their unique perspectives, have been working for change. And we would like to first welcome Kris Sandberg, who is president of Elder Voice Family Advocates, an advocacy nonprofit organization, and the owner of the Links Group, a public affairs and marketing communications consulting firm. In just 2 years, Kris and her fellow members have guided the totally volunteer Elder Voice Family Advocates to become a major voice in elder abuse issues. The work of the EVFA prompted demand for reforms and led to Governor Dayton forming the Consumer Work Group on Elder Abuse and the EVFA as one of its leaders. Our second speaker tonight is Sean Burke, who is the Public Policy Director of the Minnesota Elder Justice Center. Sean has extensive experience and understanding of the complexity of issues facing older adults, including abuse, neglect, and financial exploitation. Before coming to MEJC, Sean served as an Equal Justice Works Fellow with the Senior Law Project of the Mid-Minnesota Legal Aid, and as an attorney with the Minnesota Disability Law Center. He holds a law degree from the University of Minnesota, and when he's not working as an advocate for older and vulnerable adults, Sean attempts to keep up with his toddler twins. Kris, if you'd like to come and speak first, we'd be happy to have you come to the podium.
Thank you, Polly, for the introduction. Thank you all for the opportunity to be here and speak to you about this issue that's become very near and dear to my heart and quite a few other people's. You know, we really have an enormous problem that has been really brewing in plain sight, but yet been invisible to most of us. And 3 years ago, I was clueless. I was naive. I was at a time when my dad, after my mother passed away, decided he needed to get out of the home and find another place to go. And we we started, my brother, sister, my dad and I went and we talked to various providers, and we honed in on one. It was a lovely facility, had a theater, had a very nice cafeteria, lots of activities, all of the things that you all, you look for. But one of the things that was very important to us is that they said they would do a same-day wellness check. And Dad was 88 years old, so that was a big deal for us. And my brother, sister, and I are out of town a lot and not able to do those checks. So we chose that facility, and as fate would have it, in a very cold January of 2016, I was out of this country for the week, and my dad passed away in his room. And I got the call and I got back, but and as bad as that was, it was nothing compared to what I was about to soon learn. His body laid in his room for 7 days. Never did they do a wellness check. He obviously hadn't come for any meals. His newspapers were piling up outside his door. A neighbor across the hall said, "Please check on him, I haven't seen him." "Oh, he's fine, don't worry about it." Well, he wasn't fine. What made it worse, my brother and sister came to, they live in town, this was in the St. Cloud area, so they were able to get there right away. They got off the elevator and were overwhelmed by the odor of my dad's decomposing body. And they had to clear the whole second floor because none of the residents could stay there. So there they are dealing with this, and the facility manager comes, hands them a sheet of paper, and says, "You need your dad's room cleaned out by the end of the month." Not, "I'm sorry, I don't understand how this happened," nothing. So, and then to top it off, okay, so we had to have his room cleaned out by the end of the month. We had to have a hazmat team come in to take care of that before we could even get in. everything, all of fabric had to be thrown away because the odor had permeated everything. My son, as he was helping remove things, two of the residents, the elderly ladies, came in and told him, we're afraid for ourselves. Nobody should be afraid to be living in their home in these facilities. We were also told, well, you better report this to the authorities. So that, after the funeral and such, that's what I struck out to do. Okay. And I soon found there really were no authorities with any meaningful oversight. And as shocking as that was, I went to the Attorney General's office, I went to the Department of Health, I went to legislators, and finally I went to the AARP lobbyist, and we've got to change the law. This is a terrible situation. We started to network at that point, and that's when I got acquainted, and two other members are here, Jean Peters, one of our founders, who's our vice president, and Debbie Singer also. But as we started to share what had happened to us, it was shocking, and we knew, okay, we need to do something, so we formed as an organization. So that happened in mid to late 2016. And as we started to dig in and learn more about this, we soon found out that our cases weren't rare. This is an epidemic that's happening throughout this state. We soon got more and more people started to come to us and came with their stories, and had the courage to talk about that. And it does take courage, because nobody wants to relive some of the horrors that our members had to go through, but we did it. And let me just give you a little example of what our members have experienced. They've had mothers, fathers, usually mothers, fathers, with limbs that were amputated because of untreated infections, emergency conditions that were ignored and resulted in death, and even the failure to give basic care, which was very common to happen. Some were sexually assaulted by other residents, but even staff. There were also many instances of broken bones, bruises, festering sores, and abrasions that were a result of physical abuse, mishandling, and neglect. In other cases, our loved ones have been left for many hours without being moved, fed, given water, or kept clean. Cruel treatment was often reported, such as hitting, insulting, belittling, scaring, and other humiliations. Our members had tried to report what was going on to the Department of Health and their Office of Health Facilities complaints, but their veil of secrecy made it impossible to know what was going on, if anything, and we often found out there was nothing going on. One of our members, in meeting with her legislator and talking about what's happening, that legislator had a wonderful idea. He said, why don't you try to get the legislative auditor to review that Office of Health Facilities complaint? So we were all over that, and that was in 2017. And we were successful. I think there was something like 112 different agencies that were being suggested to be investigated or audited. They selected only 5, and that office was one of them. They found out very quickly what a colossal mess that place was in. It took, they started their audit in the summer of 2017, and it took them till March of 2018 to finish the audit. But the lead auditor had reported that it was the most messed up organization that she had ever seen. And when the report came out, it was scathing. And you may have read about some of the reports about that. In the meantime, however, it was mentioned that Kris, the reporter from the Star Tribune, did his series. And a lot of those stories he reported on were our members' experiences. And when that came out in mid-November, just 1 year ago, it literally blew the dome off of the state capitol. The governor was up in arms, and within 2 weeks he had appointed a work group of just five members, only consumers. That had never happened before. Elder Justice Center was one of them, ARP was one, Legal Aid and the Alzheimer's Association, and by gosh, this brand new little Elder Voice Family Advocates organization. But what we brought, that the others are doing fantastic work, by the way, but what we brought is what's really happening. We were able to talk about that. The problem with then when the audit came out, we had legislation that the governor said, please go through this. You have 2 months to come back and report on and give us some recommendations. So we spent those 2 months in the end of January 2018. We had not only recommendations, we had statutory language, and Sean can talk about that. He spent many of hours writing parts of that legislation. But when the audit came out in early March, the legislators shifted focus, and what they shifted to is the mess at the Department of Health and their Office of Health Facilities complaints. And that was good, go ahead and take care of that. But what they lost focus on is what was resulting out in these senior living facilities that caused this overload, this overwhelming overload with the department. Long and short of that, we did not prevail. The leadership decided that they did not want to do the kind of fundamental reform that we were looking for, and instead it did a very weak and sometimes even took us backwards in their activity or in their regulation. So that bill was thrown into the garbage bill, the omnibus budget bill, which included everything from transportation to ag. So it nearly 1,000 pages long, and we didn't see anything come out of that. So the governor told them, well, he'd veto it, which he did, and we encouraged it because what they had provided was inadequate. So we're starting over again. It's a fresh year. The good thing is that I think we've got the industry's attention, and they're now talking to us, which is a first in our experience anyway. And in the meantime, what we're doing is we're trying to educate. We as an organization, Elder Voice Family Advocates, and we're doing a lot of research that's really digging into some of this data, and we're trying to get out throughout the state to let communities know what's going on in their neighborhood. And when we get out there, I'll tell you, it's pretty doggone shocking. Just for example, we just did up in Duluth, and they had over 80 facilities that were investigated. And here's some of the quotes directly from those reports. Staff failed to provide adequate wound cares after she had vascular surgery. Above the knee amputation was required. Another case, sex toys were seen falling out of alleged perpetrator's pocket and were found on the floor of the shower room. Anyway, you've got the point here, so. And we've got the same thing in Rochester. I mean, what you usually find out is that there's a handful of seriously flawed organizations giving substandard care, and they are the repetitive abusers of the elders. So we really need to get a state system that's regulating these facilities, as it was mentioned. Our state doesn't even license assisted living facilities. We're the only state that doesn't do that. That needs to end. We need to have true reform. And the two areas that we're going to be looking at in the next legislative session is licensure of assisted living and the rights of the residents who live in these facilities. And there are many, many more facets of that. And I think Sean will go into that shortly. Long story short, we've got a silver tsunami, and we can't even handle the elders that we now have in these facilities, let alone what we're going to have in 1 decade, 2 decades. So we need to really take this seriously, and we'll, Elder Voice with our other coalition partners are going to be working day and night next session, and we hope to be able to come back and report to you at the end of the session the progress we've made. I've left a brochure here that gives you some information at the back of the table over there, as well as some information if you should suspect elder abuse, who you can call and report to. With that, Sean.
We have 2 clipboards that we'll just pass around, and if you're interested in receiving action alerts or information from either the Minnesota Elder Justice Center or the Elder Voice Family Advocates, you can sign your name and your email address. Thanks, Sean.
Thank you, Polly, and thank you, Kris. What Kris failed to mention, and I'll be talking about a little bit as I take a little bit more kind of technical policy approach, is that the grassroots organization that Kris and her partners have developed and nurtured and turned into a real voice at the Capitol won a national award just a couple of months ago by the National Consumer Voice Organization, and Kris was specifically recognized, but Elder Voice Family Advocates also at the table in Washington, D.C. And it was an acknowledgement of the importance of the grassroots voice in policymaking. Our organization, the Elder Justice Center, we serve victims by providing advocacy resources, but we aren't a traditional grassroots organization in the fact that we don't have members. We also gather experts and professionals in the field of elder justice and elder abuse, but again, we don't have members. And so our voice at the Capitol is sometimes a little more technical, sometimes a little bit more kind of formal lobbyist, and I think together with groups like Elder Voice and that grassroots voice is why this issue, one of the reasons why this issue has gained so much traction, both in the public eye, but also from lawmakers. And so, following on Kris's remarks, I'm going to spend a little bit of time to kind of give you a little bit more lay of the land of some of the real technical policy issues that are embedded with all of this, a little bit of the politics, and then I'll leave it up to you to ask both of us questions and see where the conversation takes us. So, I want to step back just 1/2 step and note that elder abuse, financial exploitation, and neglect is really a national epidemic. It happens in all communities and in all settings. It is very present in the long-term care industry, as is tonight's focus, but it also happens in family homes and in the community as well. We know that about 1 in 10 older adults, generally over the age of 60, are going to experience some form of elder abuse or neglect or exploitation. And that number jumps to 1 in 5 if the older adult has some sort of cognitive decline or cognitive issue. And so you put those stats with the growing population and demographics, then you really have a public health issue on our hands that, as Kris talked about, is not widely spoken about in public or in the media, and which is why the work that we've collaborated on in the last couple of years is so important. One of the key things when you think about policy responses to elder abuse and elder maltreatment is you really got to think of 2 buckets. You can have prevention responses, which really try to get at the root causes and get upstream. And you can have mitigation or investigation responses. That is, elder abuse has happened, who do I call, what happens, and what agency responds. Now, traditionally in law, the way our statutes have worked and the way our regulatory agencies have been developed is they are designed to do the second bucket. As we learned from Kris, and I'll elaborate on, haven't done it very well in a lot of ways, unfortunately, but from the beginning the design has been, both in statute and in practice, to really focus on responding to abuse that is alleged to have occurred. We are really, really bad at doing policy for prevention. It's actually one of the goals of our organization is to change the narrative and change the discussion, and that goes to issues around public health, treating elder abuse as a public health issue, looking at our laws and making sure that they're designed to address root causes and not just address response issues. So that's an important framework to keep in mind when you hear about some of the changes that the consumer groups have been proposing and are advocating for last session and this session and in years to come. One more kind of ground level setting thing to be aware of. When it comes to the response side that I mentioned, the primary statutory vehicle that we have for that is called the Vulnerable Adult Act. Every state has some version of this. And essentially what it is a mandated reporting statute. It lays out the group of population to be protected. In our state, it's any vulnerable adult over the age of 18. In many other states, that is defined by an age or a number. It lays out who is supposed to report, who's a mandated reporter, including nurses and care facilities and doctors, social workers. It lays out who they report to, and it lays out the duties of those investigative agencies. So in a community setting, like someone's home, the county needs to respond with the adult protection services, similar to child protection. And in the long-term care facilities, as Kris was mentioning, our health department and their OHFC, Office of Health Facilities Complaints, they're supposed to respond. And then it also lays out what is abuse, what is neglect, and what is supposed to happen. Again, a responsive type of policy. So the story that Kris, I think so emotionally and rightly put out there over the last couple of years has been the failure of the entity set up to respond to abuse to even get that right. And so, as Kris mentioned in 2017, in large part due to their advocacy efforts, the legislature did 2 things. No small things. They set out the report. They also allotted $3 million in that budget year to add staff to the health department, ostensibly to fix OHFC and respond to more complaints. And I think without the articles that came out in 2017, without the sustained push from voices like Elder Voice, I think we would have had in 2018 a session that got the legislative auditor's report and really kind of stayed focused on this bucket of response, right? Hopefully would have fixed OHFC, and there have been quite a few significant changes to that office, not least of which they've changed from a paper system to an actual computer-based programming system. But I think without that sustained pressure and that grassroots movement and that series of articles and the report put out by our 5 consumer groups, then this is where we would have stayed. And as I mentioned at the top of my remarks, prevention is really where public policy needs to move its focus. And so what I want to do is walk through some of the consumer suggestions that our consumer group that Kris alluded to proposed and explain why we think it will add to the prevention piece of regulation. So, in that consumer report that I mentioned, in the legislation we proposed last year, and then in legislation that will most likely be kind of reintroduced or reanimated this coming session, I want to point out kind of 3 main areas on the consumer side that we think are important for prevention. Number 1 is the licensing of assisted living in Minnesota. As Kris noted, we are really the only state that doesn't have a licensing regime. Now, that is not to say that there's no licensing. It's not to say that the health department isn't looking at this at all. But what we have is a really confusing system that was not designed to deal with the volume of individuals in this system or the acuity, the level of care that some of the patients really require in an assisted living. And so what we put forward is, listen, scrap the old system. The old system says, in assisted living, you get 2 contracts. You get your services contract and you get your housing contract. And that is supposed to provide choice and freedom, and it's supposed to kind of mimic the private market. But we know that people living in assisted living, and even when you're marketed to an assisted living, that's not necessarily what you're buying or what you want to buy. You're buying some peace of mind. You are buying a new place to rely on services. You're buying the ability to hopefully also age in place in those in that setting as well. And you talk to anyone off the street and say, hey, by the way, did you know that you're in a housing with services registration system where the licensing is, where the services are licensed but the housing is registered? They'll look at you like, what? No, I'm in assisted living. So we said, scrap that old system, create a licensing system that has tiers and recognizes that in some assisted livings you're going to need more services, in others you're going to need less. And in that one license system, really importantly, there is one accountable entity. One of the things the legislative auditor said in the report is they would come on site to an assisted living facility and they would spend 5, 6, 7 hours figuring out if they even had jurisdiction. Because of course the health department right now only licenses the services. And so if they can't really figure out who's actually even in charge or whether a complaint is dealing with the services or is it dealing with the housing, then you have a real kind of fundamental flaw with the way the system is set up to be regulated. And so we are advocating for some common sense reform. One licensed entity to be licensed for both the services that they offer and also the setting that they are responsible for. Now, of course, any big licensing statute, a lot of the devil is going to be in the details, and we anticipate this session most likely there will be some proposal, and we hope from the health department, who has been gathering stakeholders this fall to talk about this issue, and a couple of things to note within a licensing statute. One of the most important indicators about whether or not there's going to be safety or quality in your facility, whether it is a nursing home or assisted living, is the staffing ratio. How many trained staff and trained in the discipline that is being offered, especially if it's a memory care unit, how many of are those staff available to serve how many people in the population? Different statutes deal with this differently. Some states license assisted living, but they don't say anything about the staffing ratios. And so it's not enough simply to advocate for a one entity license system. There also has to be some underlying regulations within that licensing that get at some of the root of the problem. So that's one consumer area where we think can deal with prevention. Another that Kris also mentioned is strengthening resident protections and Bill of Rights. Just about every state has resident Bill of Rights if you live in a long-term care setting. We have about 4 or 5 of them, and they're scattered all throughout statute, and it's confusing what rights you have if you're in a nursing home as compared to a hospital as compared to an assisted living. So we do advocate for some clarity and some cohesion around that, but much more importantly than that is that the rights of consumers within assisted living particularly are strengthened. Right now, there's no right to be free from retaliation. So we say add some common sense rights to the list of the Bill of Rights. Free from retaliation, free from deceptive marketing. A lot of the issues that arise happen because that first walkthrough that you do at the facility, Kris mentioned there's a nice fireplace, there's a movie room, there's game activities, everything. You don't ask about the staffing ratios. You don't ask about the quality of care. You don't think about some of those things. And so what we ask is we want to put the onus on the provider to make sure that they're not just in the business of upselling because of the furniture, but they're in the business of accurately matching what they can offer with the needs of the consumer and being much more forthright at that upfront level. The other thing about Bill of Rights, though, is in many, many other states and in ours, unfortunately, they're aspirational pieces of paper on a statute. Statutes really are only as good as how they can be enforced, right? And unfortunately, when it comes to all of these regulations, we've already talked about the health department's not great at enforcing the rules. So we expect them to also enforce individual patient Bill of Rights. So what we advocate for is the ability for an individual themselves, if their rights have been infringed upon, that they can bring their own lawsuit in order to kind of vindicate those rights. I can get more into that if people have questions. And finally, this isn't all of our suggestions, but these 3 are really, I think, the most important when it comes to prevention. There are no clear protections or strong protections for individuals living in assisted living being protected against unfair discharge or termination of services. When it comes to health facilities or long-term care facilities, you may be renting that room. In many places you are. And what our current law says is we're going to let landlord-tenant law kind of deal with that situation. And landlord-tenant law is great. I used to be a housing attorney when I was at Legal Aid. There are some really good protections in landlord-tenant law. It never really contemplated an agreement where you're both living and receiving services, sometimes really significant health services. And so what we've done in other areas of the law, including the nursing home statute, and including our group home statute, 16,000 individuals with disabilities in the state live in 4-person group homes. Those people living in those settings, they have enhanced protections. They cannot just be discharged willy-nilly. There has to be a reason, a really specific reason, related to your safety or related to your healthcare needs becoming way too hard before a nursing home or a group home can kick you out. Not so in assisted living. And so we are asking for the assisted living protections to mirror or at least be comparable to the other types of facilities that people live in where they are very vulnerable if they have to move on a moment's notice. So, where are we at going forward? As Kris mentioned, our changes were not brought forth last year in part because of the veto. The world has changed this session, so we anticipate all of these ideas hopefully moving forward, and we will be advocating for them. Also, the health department got involved in a much more robust way than they have ever been before by leading working groups this fall. Informal working groups, but working groups. And so we anticipate on some of the more technical pieces, especially the licensing, we hope the health department will also take a lead in that. So suffice to say, in May at the close of session, not all problems will be fixed, but I am hopeful that we will have made steps to do better policy on prevention as we continue to fix policy when it comes to responding to complaints already made as well. So thank you for your time tonight, and we will answer questions.
Why don't you come back up and you can switch back and forth what the questions are.
Yeah.
What the questions are for. If you want to just call on people and.
We call, you know?
You do that, it'll say right there.
Okay.
I would like to ask, my parents lived out in Benson, Minnesota, Swift County, and the nursing home there was not good, and so my mother had my father go to Wilner, and then my mother was in Benson, and you can't expect people from Swift County to call the Commissioner of Health and do something. What are the layers in the county where there has to be protection right there? And my brother and sister-in-law went to the nursing home every day. My husband's in a long-term care. It's a 5-star. I go every day, and you have to be there for other people, because a lot of people don't have any loved one there, and so I'm kind of looking out for them too. But I'd just like to know, in your plan, where are the levels so that in the towns people are going to do something in Duluth rather than calling, St. Paul.
So a couple of facets to your question. First of all, on the levels. This really gets to what I was saying about prevention versus response. First of all, when the OHFC responds, it's not just St. Paul. So if there has been a significant issue related to maltreatment, that is supposed to be reported, and anyone can report, and there's actually on how to report on both of our materials. You call up one number, it's called the MARC line, Minnesota Adult Abuse Reporting Line. They filter that complaint to the health department, and then the health department will look at it, and if it's severe enough, and they're interpreting that Vulnerable Adult Act, right? If it's severe enough based on that act, then they will investigate it. If it's severe enough that investigation means boots on the ground, then they'll go boots on the ground. But that's the levels you're talking about. In order for a complaint to rise to the level of getting someone from the health department out, even now that OHFC is fixed, because of our Vulnerable Adult Reporting Act, because of the amount of resources put into this type of work, there's a very good chance, unless it's a really significant issue, it will not get investigated at that level. So what other resources exist? The other one that I always talk about and that we are working, and I think is better on the prevention side, there is an office in our state called the Office of Long-Term Care Ombudsman. The Office of Long-Term Care Ombudsman. They are also statewide, and there is a regional ombudsman to cover both of the areas that you're talking about. And what that person does is anytime there's any sort of whiff of something's not right here, you can call up that office, and they will and are charged with coming out and working with the individual themselves, the resident, to try to kind of resolve the issue. Now, they are underfunded, as you can imagine, and so we are, along with them, pushing for them to be funded, if not properly, at least a lot more so. I think the idea on the table is 10 more ombudsmen for their office, which would almost double their capacity. That would be about 50% of their capacity. So, anything else?
Yeah, and I would point out, this varies widely, county by county. You have some counties that really do a nice job of handling this and interfacing with the state, and other counties that aren't. So, good luck, I guess, on that. Isn't that sad to say? And also keep in mind, like the Office of Ombudsman, they have no teeth. That's the problem with going to them. They have to go in, first of all, if they can even go in, if they have authority to go into that facility. And it's pretty much a pretty please where you shape up. And we know how far that always goes sometimes too. Other questions?
Is there a percentage of profit or non-profit, so to speak?
There is. The question is profit versus non-profit. There is. Unfortunately, I don't know it. But I would also say from experience, and maybe you can chime in. Unfortunately, there's not always a huge. You can't look at the stats and say, oh, the for-profit places, that's where all the problems are. The non-profits are great. In fact, there doesn't seem to be a clear correlation when it comes to maltreatment reports on that. And in fact, the industry folks are represented almost kind of half and half. Half the industry's non-profit represented and half is for-profit. So to me, while that's an important distinction in other industries, in this industry it does not seem to make a difference.
The other thing I would say is whether it's religiously affiliated or not doesn't seem to matter either. So don't have any false ex. Jean, I think Archie may have more information to add.
As far as nonprofit, as far as profit and nonprofit go, what you need to look at and remember is the house, the facility, for-profit. Are there real estate investors that are building all these facilities? And then is the home care that you're bringing in, which is separate, these are separate, they may be affiliated with either a religious organization or a hospital group, and they may be nonprofit. So it's all messed up.
I'm just wondering, nursing homes and places, they require some background checks on the employees. Does that hold for the assisted living people?
So I mentioned earlier our system in assisted living, the services generally are licensed, and part of that license, it's called a home care license. Part of that license includes kind of background checks and the like. So yes, however, you can potentially be in a building where the services are licensed, as Jean just mentioned, but the building itself is operated by a completely different entity. And so building maintenance staff or other people related to the building piece, because it's only registration, we don't have that one license I was talking about, there are gaps there.
All right, so those people aren't licensed, and the owners of the assisted living buildings, they really don't do a background check from state to state to see where problems exist.
Another one of the gaps there in problem staff is when a facility finds out they've got a problem person, they fire them. They go down the street.
That's my point.
And they're hired because there's no tracking mechanism to keep track of where these problem people are.
And so the question is not, is there background checks, which there are.
But what's the communication from place to place?
Exactly, and are they effective? And part of that is the OHFC's fault in not having a clear enough database and a clear enough system to have enough consistency there.
Yeah. Okay.
Here.
When I hear these horror stories, and they are horror stories, my thought as you were talking was how many of these are actually in nursing homes and how many are in assisted living or other than nursing homes, non-licensed places.
Well, we're more focused on the assisted living because nursing homes are far more regulated. There's far more oversight.
You know, my impression is everyone says, I don't want to be in a nursing home. I think I'd rather be in a nursing home than assisted living.
But that's what they're marketing to.
I know.
Because people have that, oh Lord, not a nursing home, I don't want that. And it's attractive from the residents' point of view because they want to be in something a little nicer, and that fireplace is kind of nice to have, you know, and some of these other superficial, you know, amenities. So it's really become assisted living. I think when it started out, it was probably a good concept, but what's happening is they're accepting a wide continuum of needs that have to be addressed. And some of those people should not be there. They should be in a skilled nursing facility. And then on the other hand, you've got the independent living. Same thing is starting to happen there. They're starting to, matter of fact, they kind of want to shift it. And remember where the profitability is. They're highly profitable in the assisted living and independent living area. That's what you're going to see really mushrooming. You know, a lot of investment's going to happen with that.
One reason I have read that they are so profitable is that they hire staff who in many cases either have language issues because they're immigrants looking for an entry-level job. They are looking for an entry-level job because they don't have much education or training, certainly not specifically for caring for sick elders or potentially sick elders. Has there been any move in this state, as I have read of elsewhere, to promote a licensing and certification of individuals so that people who wanted to get into this field could follow some sort of learning track, which many people would like to do, but they'll take whatever they can do to get food on their own tables. I understand that, but the theory is that if we could have a better prepared pool of workers, part of the problem might be alleviated.
Then you have to put it on.
Staffing is the elephant in the room. It permeates everything, not just senior living. It's the issue we all have. And I would say that, in the training of that staff, no, that's where we're seeing lots of terrible,
I mean, some of the problems are negligence rather than intentional injury.
What we're seeing, yeah, there are some bad actor staff people who are just mean, whatever. But it's usually because they haven't been trained and they are overworked. They're being spread thin. One facility down in the Rochester area had one staff person for 55 residents. How in the world can that?
And this is why, so you mentioned, are we looking at it? So we are. Staffing ratios, as I mentioned, is one way in which you can start to, but of course then you bump up against just the flat reality that we have a workforce shortage in this industry. One of the reasons is because it's not professionalized very well, and we're getting to some of that. But along with that comes the other elephant in the room, and that is pay for these individuals and how they are compensated. Last session, there was a few lawmakers who just raised the issue. They didn't bring a bill for it because they knew it wouldn't go anywhere, but they raised the issue that there should be a minimum wage in this, a heightened minimum wage. They said $15 in this industry because you can work at a care facility and do some really hard work. Especially, imagine if you're the person making $12 an hour on that 1 to 55 shift, right? Why don't I just go down the street to McDonald's and make $15 an hour as a shift manager or more? So that is a real reality. The industry has, for their part, talked about this as a problem. But when you talk about an industry where there is quite a bit of money, how do we know that it's not trickling down to where it should? Now, when it comes to policy solutions to that can get tricky. We can demand, if we're the public payer, and some people do live in long-term care settings with Medicaid and public funds, then we can have a little bit more control and say, hey, provider, you need to allot this much to this, this, and this. But in Kris's situation, and a lot of situations in the assisted living world, it's private pay. We have a lot harder time regulating through policy and statute what a private entity, whether they're for-profit or non-profit, what they can actually kind of do with their money. And so this is a long-term issue that we're going to have to address as a local community and as a nation as well. And the workforce issue is one where collaborative solutions with the industry and others is really important. But yes, the answer to your question is yes, we're looking at it, but that is a prevention issue that cannot just have one policy solution. I think Gina wants to say.
I'm a nurse practitioner by training, and a couple things.
Gene, stand up.
Okay, I'll stand up.
Why don't you just come up?
Yeah. I'm going to be quiet after this issue, but this is one that's very near and dear to my heart because you're right. These are people that are maybe come from another culture that don't understand the China teacups in the fireplace, and they're trying to make a living. Nationwide, 40% of our caregivers are on public assistance. We learned, our family learned, that the majority of the caregivers in the facility were hired at part-time because then benefits didn't have to be paid. And they were working 2 and 3 shifts in a row. So you have that. at a low pay. So this is where we need to ask when you go in, how much do you pay your workers? How many people are on staff today and how well trained they are? The second thing is, and it's a policy change that can be done, I believe, at we need to talk to our legislators. Right now, I want to be a nurse's aide at Happy Acres. So I'm hired. And I have 160 hours to complete a training. But I'm hired and I'm taking care of my mom, who lovely, but sometimes was very stubborn. And I really don't know how to handle that, but there's no requirement for staffing, and in 138 apartments, the person that's supposed to be supervising me is on the 3rd floor. And now I've got my Irish mother saying, hell no, I'm not going to dinner. And this one aide who's not trained, because it's within that 100, is, come on. And suddenly my mom is covered in bruises. So what we can do, what I believe we can do, is let's have good training before you step foot in the building and before you start caring for people. Let's start having jobs where there's dignity, where I know that I'm going to have the same person every day taking care of me, because that would be wonderful. So you're right. There's things that can be done on a policy level. Home Care and Assisted Living Advisory Council last year, I was on it. We proposed high school students being able to take classes and get college credit for it. That hasn't gone anywhere. It takes a long time, but there's things that we can do as a community. We just have to sort of open our mouths once we become aware of it and say something. Say something to your legislator. So I'm done. I'm going to sit down.
Over here, you've been
So, I'm sort of jumping on what you said, because it feels like, and sounds like, I have a mom who's in a long-term care facility right now, and we're dealing with some issues that you've alluded to already. But it feels like a lot of this is about educating us as the public, because I certainly wouldn't know the staff ratio question to answer, or how often will my mother get, I do now after kind of bruises on me, trying to figure it out, but I'm sure you've run across, here's 10 questions you should ask when looking for yourself or for a loved one that helps me make a better decision.
And we're going to be Elder Voice Family Advocates. We're working on providing that on our website, and National Consumer Voice, I think, has some information to help people out. But like in my case, I wouldn't have known enough to even ask. I didn't know what I didn't know. And that's why we're working so aggressively to get out throughout the state and have community meetings, invite the media, invite the policymakers to come. But we're a small volunteer organization, and you guys are doing a lot of education. You might want to mention some of that.
So one other organization to look at nationally is Justice in Aging. They're out of California, and they talk about a lot of these issues as well. And another plug for the National Consumer Voice is the name of the organization, has been advocating nationally for long-term care issues for decades. And our organization also sends out a monthly newsletter, and our website also has a ton of resources as well. Just one other piece of this issue is one of our mission at our place is to make elder abuse a common kind of household topic. That is not to say that is a cherry topic, but think of domestic violence or intimate partner violence. And in the 60s and 70s, it was a cultural phenomenon that wasn't really talked about. If a police was called to a domestic dispute, they would oftentimes turn their back and say, oh, that's a household issue, that's a civil issue, right? Decades later, we have come back and we have a huge infrastructure. That doesn't mean domestic violence is solved, but think of the way that we talk about it, think of the way that it's studied, think of all of the infrastructure that we have, just at the legislature alone, the interest groups, the advocacy groups built around that issue. In the elder justice world, in the elder abuse world, whether it's happening in a long-term care facility or otherwise, we are decades behind the domestic violence movement, child abuse movement, and in fact, we only had our first national elder justice law federally in this decade, essentially, 2010. We've had laws on the books to prevent pet violence for decades, right? And so part of this is that we are in the dawning of an era of a social issue, a public health issue that you have to think kind of long-term about. And so that societal conversation and the development of elder voice as an example of that is comparable to the earlier stages of things like the public health or the domestic violence and child abuse movements.
And I would just add to that the stigma that goes along with, I'll take my case. Where the heck were you for that 1 week? Why weren't you checking on your dad? And that guilt, that you feel. Or the other situations where they're trying mightily to get the facility to give the care that they're paying for, and they're just getting nowhere. And it's enormous guilt and trauma that the family members are experiencing. And so it's kind of the same thing. You've got to get past that. No, you don't need to feel guilty. You need to do something about it.
Back in that corner.
Yeah, the advocacy is wonderful. The education is wonderful. I'm just wondering, and to go along with this, is there a recognized set of either national or even international set of best practices?
No.
Is there something proven out there, or are we collectively inventing it here, and somebody's inventing it over there, and there's conversations going on, but there's nothing recognized to say, hey, this is the gold standard?
So, are you talking? Give me a sense of kind of what you're thinking. Gold standard of what?
Proper care.
Well, I mean, you've got your two buckets.
Okay, yeah.
In either bucket, is there something that said, this is, we've seen this work over the last 10 years in this place, and by God, this is what, or either that or like a parallel to an ALEC organization, somebody running around behind the scenes saying, here's what you need to roll out, guys.
Do this one, do this one, do this
one.
So unfortunately, Kris is generally right. No, Justice and Aging, the Medicare Advocacy Organization, I think I got their name right there out of DC, Medicare Advocacy Coalition. So the earliest movers in this world fought at first to regulate nursing homes. And the federal regulation of nursing homes happened kind of in the 80s. And from a statute regulatory perspective, I hate to use the word gold standard because it's barely a bronze, but it does provide some really key protections, not least of which is the discharge protections that I mentioned. And because that's federal, then at least all of our nursing homes around the country have to at least meet that kind of baseline standard. A quick side note, we've seen, with every statute also comes a bunch of regulation, right? Statute, Congress, or the legislature has to change. But regulation, the regs, they can be changed by the agencies, both state and federal. So sorry if this was Legislative 101. What have we seen in the last couple of years under this federal, hold my words, not regime, administration, is just like they're doing, and they're just right out front, they say this is what they want. They're rolling back regulations that flow with the federal nursing home statutes. And so surveys have to happen less, rollback of emergency preparedness, and other issues. So that's the federal picture. And what advocates would say was at least we have OBRA, is what the law is called. At least we have a federal nursing home statute. It does not, there's a big fight about it, it does not have ratios in it. It has some language about staffing standards, but it does not have that key piece of ratio. So when we talk about best practices, we do have best practice. We know, the literature essentially tells us that you have better ratios, you have better safety and health outcomes. So we have that best practice, but when it comes to the actual legislation, then when you get into what states are doing with their assisted living, I said we're not licensed. That's wild to me that we're in Minnesota, we're not licensed. But a license doesn't mean much if it's not done well. And unfortunately, states are all over the board in terms of how they do it well. And the most common thing is some states will do some well, things well in one area, and then they'll fall off in others. So it's as we're looking for models to draw from, I have yet to find a state that we would say, yes, that's what we should
Now,
use here.
there are theoretical models out there, but nobody will touch them with a 10-foot pole because nobody being the industry, because they're going to have to do a whole lot more than what they're doing now.
And what best practice says about staffing ratios, right, doesn't equate with literally the staffing shortage that we have and other issues with that. And so there are practical challenges with implementing it, let alone the political challenge of getting something passed.
I know I said I was going to be quiet. The Keck School of Medicine has a fascinating, just a lot of literature that you can look at for this. The gold standard now in assisted living, aides per resident, they're not patients, they're residents, ratio 1 to 23 is the gold standard. That's our gold standard.
Was there one over here, and then we'll move our way back? Yeah.
Until you expand the demographic in this room, this topic, isn't going to have the results that you want. You need to talk to your children and your grandchildren and your neighbors about this issue, so that does become a discussion that expands beyond the aging demographic. And I don't feel comfortable sitting here and not saying that the aging services industry is a huge advocate for older adults. It's not just elder justice around nursing home and assisted living abuse. And as Sean said earlier, a lot of exploitation and abuse occurs with family members. So I just want to make sure that if you have the opportunity to talk to younger people who care more about people and profit, the assisted living industry is about profit. Mm-hmm. This generation and older care more about profit than people. That's right. I think the younger generation does not. They are the generation that can change what this will be for us, as we need some sort of ability to stay in community, whether it's assisted living or not. So talk to younger people about this issue.
I would just add on to that, talk to your legislator. They're the ones who can make immediate change.
Well, I wanted to say, what saved me was I had a palliative care team come to our home. I was a caregiver for 16 years, and a visiting nurse came to our home. And now people know me. You wouldn't think I'm this sorry little person that couldn't take care of my husband. But when somebody comes into your home, they see how you are really living. Mm-hmm. And it was very helpful. There was a chaplain and a social worker and a nurse. And my dream is to have a palliative care team in all the quarters of Hennepin County, and they came every 2 weeks, and they helped guide me to have my husband go into a nursing home, because I wasn't doing it all right. I got worn down, depressed, and we have to educate all the family members, and they're often very young family members that are not even living their life dream, because they're the only one in that family that's carried, for the family, and so we need to be educated to know what we want and find the best, best place.
I want to raise a little different aspect of this, and that is people who are living in their own homes. Yeah. I was talking with an inspector recently who said, I see all these houses in Minneapolis that need work, and he said, I know a lot of seniors who are living in those houses, and they're just letting them go until they go, and they're neglecting themselves, but they're not reporting to you because they're not really abused. But do we have any sense of the extent of problems out there of people seniors living in their own home and not living the way they should be?
So goes back, we do have a response system set up every county. It's called adult protection system. And it goes back to that responsive bucket that I talked about. And it is actually the largest system. Now it's county by county, but it is many, many, many more times, serves many, many more people than the OHFC or the Department of Human Services. And self-neglect is actually part of that statute. And so how these cases generally come about is a neighbor or a loved one oftentimes become worried enough that they make a call to that center that I talked about, the abuse reporting line, and then the county will come out and open an investigation. Now they're not looking at, in that circumstance, to put blame on anyone. They're wearing they're called adult protective services, so they're wearing their protective services hat, which unfortunately, this is a much different topic for another time. Our vulnerable adult statute is not good about the protection piece. It's very, very good about investigations. Good. It's very clear on what investigation is supposed to happen. It gives very little guidance to counties about how they're actually supposed to provide services to this individual. And so that ranges on county to county, sometimes worker to worker, in terms of what they're going to do. But the short answer to your question is yes, we do have a regulatory system set up to respond to those individuals. We know self-neglect behind financial exploitation is the second most commonly reported or response by adult protection, so it is a large issue, and we know adult protection is vastly underfunded and vastly undertrained. A lot of this, they don't use a paper system, but a lot of the same issues that plague our other kind of regulatory bodies also plague our adult protection system. They're doing the best they can, but they have to wear two hats, investigators and protectors. And when it comes to those situations you're talking about, those are really difficult, tricky situations. You have family dynamics, you have personal kind of psychology issues, you have autonomy issues about that individual and their choices, not least of which to mention services and housing issues and everything else. And so that is added on top, and it goes back to the point over here as well, that elder justice issues are a community-based problem, and for too long they have just been a problem that only the regulators or our state agencies have thought about. So you raise a good point, and I would think hard about those individuals in your life that need that extra reach out and that extra network and that extra support. Sometimes the unpaid caregivers are going to be the most important people in their lives.
Is this going to be viewed in a bipartisan way when the session starts and after the new year? And is there, with the money involved in some of, for instance, increasing the number of ombudsmen and other funding that's needed to expand to address issues, is that going to be available? Is it going to be?
I hope so, and I hope so.
It's a little early to tell because of the election resulted in now a flipping of the House to DFL control. The Senate's still Republican control. And
by one vote.
Yes, so yeah, very purple. And what we're going to have to see, there's lip service being made by both sides actually, that they're going to address this. So we'll see how serious they are, and our intent is to work with anybody and everybody, both parties, all parties. So, but politics rears its little ugly head once in a while.
It is a bipartisan issue. Where it breaks down sometimes on partisan lines is, like a lot of things, especially in this state, is geography. And you will hear arguments, you talk about the workforce shortage or, ratios being kind of an underlying issue. Basically multiply that problem by 5 if you're going to parts of greater Minnesota. And so I don't necessarily think the geographic arguments are always that far apart. It's hard to find good qualified staff in the cities as well. But to the extent that there is partisan problems, I would consider those regional differences that sometimes do have kind of legitimate differences.
I do believe the philosophical differences are the big deal, and it's philosophically what's the role of government, and there's different viewpoints on that. And yes.
Has anybody approached you? Are you working with anybody at this point?
Oh, gosh, yeah.
From the legislators, yes, I mean, they have approached you.
This is a high priority for for
Because mostly
legislators.
you talk about education and so forth.
We're approaching them, put it that way.
You're approaching them,
Yeah.
because they're not mentioning it. I mean, you see.
Oh, they're very receptive. No.
Well, I'm not saying they're not receptive, but it's like, that comes much further down the list.
Well, let me put it this way. One of who's now going to be a new chair of a key committee that we would be going through has assured us our bill will be one of the first heard. So I'm far more optimistic this session than I was last year. And I agree with Sean, it's not it shouldn't be a partisan issue, but it becomes that way.
Did you suggest the problem is much worse in rural areas?
No, my suggestion is that when you talk to lawmakers and providers and families, both the reality and the perception is that in rural areas, especially the issue of staffing and that problem of finding qualified staff and number of staff to fill the need.
And are we saying that's the basic issue here? Okay, go ahead, finish.
Yeah, well, they will always say number one, that's our biggest problem. And so to add on regulation or to add on any requirements, you are going to lose providers in this region. And I would argue that the staffing issue is also pretty difficult in the Twin Cities. And so that all I'm suggesting is that there are regional differences and there may be some legitimate reasons, but some of the same arguments and concerns still apply.
And I would just give you an anecdote here. And I know of a facility up in Pine County, and it's the third poorest county in this state, and it's very sparsely populated. They've got a thriving facility there, and the reason is they pay their people more than what they can get anywhere else. And guess what? They're growing their beds are full, they are giving great care, and those employees love being there. So I think part of it is our providers need to kind of figure this out too, that, wait a minute, we're gonna be better off by doing better by our staff.
I would cut it off. But I have one last question for the two of you, and that is, what do you want us to do? We are folks who talk to our legislators and are cognizant now of what you said, but do you have parting words for us exactly what we ought to do or say?
If I might, and I'll let Sean know also, we are going to be putting our legislative agenda together. And please, either sign up on the sheet if you want to be put on a list so that we can email you and give you those updates and let you know what's going on. And that's being rapidly worked on here during this month of December, because session starts January 8th. And we'd be happy to keep you updated as we go through the session, and you guys are probably doing something similar.
Yeah, we are doing something similar, so also sign up for our organization as well. And again, we are broader than the kind of the issues we talked about here, so some of the stuff, depending on our interest, may wax or wane. In terms of lawmakers, if you have a meeting with them, tell them the importance of prevention bucket of policies. And you can use our resources to kind of help flesh out some of that conversation, but talk to them and say, for a long time, our legislative and kind of legal responses have always been reactive. We're always reacting. But what can we do to be much more proactive? And sometimes that's going to cost more money. It just is. But that is kind of the question that you can then flesh out with some of our resources and materials. But that is a key evolution that we want to see change in the law when it comes to preventing abuse and neglect of vulnerable adults and seniors.
Well, thank you very much.
What's your expectation of the legislature? Better than before? Or?
Yeah, I am very hopeful. As we've already seen prior to the legislative session, there's discussion about reforming some of the practices of the legislature, and in talking with lawmakers and other stakeholders, especially around issues of elder justice and elder abuse. There's a desire to really get things done in a way that they haven't before.
I realize this is a little touchy on names, but do you have sponsors? You spend a lot of time in this legislature.
This last session, yes.
Okay. I used to cover, but without crossing political issues. Do you have some sponsors, some people who are understanding? What's her name? Murphy, who's a nurse, of course.
Yeah, and she's of course no longer at the legislature.
Tim Abler is a chiropractor.
Yeah, there are lots of lawmakers who are.
Rude was a nurse. I knew she was from my district.
So all the names you've named are on the committees where these issues are discussed. Although, of course, Representative Murphy's no longer at the legislature. But
do you have some advocates there that you feel comfortable with?
Yes, we do.
Yeah. Is there some standard classification? I mean, nursing home is kind of out at the end.
In Minnesota, no, and that's one of the things that we're really pushing for. In Minnesota, we have a system called Housing with Services and Home Care Services, and it's a combination of both registration and licensing. It's very confusing, and there's not a real clear message to consumers about kind of what to expect or what you're in. We also have something called an assisted living title protection. So when you add all that,
is assisted living, is that an accepted category?
It is something that providers can designate themselves as, but they're not held to those standards in the same way as a traditional licensing statute. And so compared to other states, we do not have the same type of kind of robust licensing system for assisted living.
Nursing homes are pretty well defined.
Nursing homes are federally defined. And so there's a federal statute that regulates nursing homes in a fairly robust and strict way.
There's a range of assisted living facilities.
Correct.
And that's kind of up to who owns it.
Correct. And the range depends on where you live in Minnesota. Frankly, it depends on where you live in the states. All the states are different in the way they regulate them.
What's your expectation of that? That's going to be tightened up as a formal definition?
Again, the definition of a unit is different depending on where you're talking about. In our state, it is a landlord-tenant relationship. So you can think about it in the landlord-tenant way. We have most of these places that we're talking about are rentals, and we have a rental shortage throughout the state, especially in urban areas. So I think of the assisted living, to the extent that there is pent-up demand for this, I equate that in a similar way that we have demand for all sorts of affordable housing for all populations. Now, in public work groups that we and others, including members of the industry, have been working on in this off season. There is a lot of energy to change the status quo and to bring some sort of licensure and assisted living to the fore. What that actually looks like, how it plays out, the timeline, and all that. I don't know, but I do anticipate change for sure.
Combination facilities, are they not? Because I was in a rehab center for my knee, but there were also nursing home people there, and we had the common kitchen and PT area. Is that common?
Yeah, that's growing to be more and more, and also this offering that continuum of care, so that you can age in place.
Do you have any idea how many assisted living facilities there are in Minnesota? Or Hennepin County?
I don't. No. I could easily get the number, but I don't know offhand. So
hundreds.
Yeah.
Okay, growing.
Yeah.
Okay. What's your expectations for the legislature? Are you going to do some good this year?
I really am hopeful. I really think we might get some really, significant progress on reform. So I'm hopeful. We've got a lot of legislators talking about wanting to really work with us. So
you have reasonable. You don't have to name them, but do you have reasonable sponsors, people who are going to advocate?
Yeah, and we've got a lot of newly elected people that are physicians, healthcare, so they're people who really have knowledge already going into it. So I'm optimistic, and like I said, now the chairs of the new committees are very supportive of getting some reform of elder abuse.